Welcome everyone. Peter Fonagy, Chief Executive of the Anna Freud Center. I'm delighted to be introducing the latest of our transformation seminars. The theme of our transformation seminars has always been thinking differently about mental health. The seminars provide a public space to explore and reflect on how we might think about the growing problem of child and family mental health. The seminars invite speakers to respond to a simple question: what is their idea to transform children's and families' mental health in the UK? The seminars explore areas beyond clinical interventions. Important though these are, to ask how we can think about, understand, and do things differently, individually, collectively, and as a society. Just before we start, a bit of housekeeping. If you are tweeting us, please use our handle at EFNCCF and use the hashtag Transformation Seminar. You will also see Emma Lawrance's handle in the chat function now at Emma L. Lawrance. Emma will talk for about 50 minutes, after which there will be a Q&A. If you have a question for Emma, please use the Q&A button. We have two ESL interpreters on screen today, Rob and Paul. They will be signing during today's webinar. Closed captions will also be available. If you would like these enabled, please click on the closed caption button on the screen. We very much hope you enjoy this seminar, which is delivered as part of our commitment to providing free, accessible events to all those who support children and young people. We understand that during this difficult time, you may be interested in how you can help us to continue our services for children, young people, and their families. You will find more information as to how to show your support at the end of the seminar. I'd like now to extend a very, very warm welcome to our transformation seminar with Emma Lawrance. Dr. Emma Lawrance is the Mental Health Innovations Fellow at the Institute of Global Health Innovations, IGHI, Imperial College London. Hi, Emma. And she leads the Climate Cares program, working with researchers, designers, and policy experts to better understand and respond to the interconnections between climate change and mental health. She does this for the communities of a safer climate future. Tonight, one of the designers working with Climate Cares, Pippa Beatty, is with us behind the scenes. She won't appear, but her contribution is greatly appreciated. Emma's other work focuses on digital mental health and youth mental health in collaboration with Shout Crisis Text Line, which I know well and admire deeply. You do a fantastic job, Emma, and we're all proud and benefit richly from your contributions. Emma completed her MSc and DPhil in computational and clinical neuroscience at the University of Oxford. She also holds a BSc in physics and chemistry from Flinders University and a science communication graduate diploma from the Australian National University. She's the chair of trustees and co-founder of the youth mental health charity It Gets Brighter. She loves spending time in the natural world, particularly her homeland of the Adelaide Hills, and on a bike. Other than the bike, I resonate with you totally. Today, she's talking about the underappreciated connections between climate change and mental health. But really, she's a pioneer. Increasing awareness and experiences of climate change brings key questions. How are children, young people, and their parents responding emotionally and psychologically? What are the implications for a generation inheriting an existential threat? What are the impacts on mental health? And what coping strategies are most protective? What does it mean to be mentally healthy in the face of a society requiring such radical transformations? How can we create a society that enables people to flourish and thrive? I'm absolutely delighted and deeply honored to welcome Emma Lawrance to give her transformation seminars. Emma, very welcome to the Anna Freud National Center for Children and Families. Over to you.
Thank you so much, Professor Fonagy. It's an absolute delight and honor to be here this evening. And thank you everyone who's joining both in the UK and globally. My colleague Pip Beatty will now share the slides and we can get started on understanding the synergies of how we can transform society for a safer climate and healthier minds. And I just wanted to check, is my internet stable for now? Great. Okay, so we'll dive right in. So Peter very kindly introduced me. I grew up in the Adelaide Hills, and even over my lifetime, I've seen the bushland around my family's home change. The heat waves are getting hotter, the bushfires are getting more intense, could smell the smoke in my family's home in 2020, and the koalas are now starting to ask for water. It was in the Adelaide Hills I completed my degree in physics and chemistry, then went on to study science communication before I came to the UK to study neuroscience. And in my DPhil or PhD, I was looking at how uncertainty is represented in the brain and how people with a tendency to experience anxiety process uncertainty differently and how this interacts with decision making. At the same time, I founded the youth mental health charity It Gets Brighter, which really came from my own experiences with mental illness as a teenager. So I'm sort of an expert by lived experience, I guess, as well as a researcher. This led me to my role at Imperial. And as Peter said, I've been very honored to work alongside him and the colleagues at Mental Health Innovations on research with the Shout crisis text messaging service. And so it was as in this sort of environment in a few years ago at Imperial that we came to a question. What does society look like for children and young people's mental health? Why are we seeing escalating emotional distress in young people? For example, in the context of the Shout service, young people tend to ask for help, many of whom are not accessing traditional services. And list of this Professor Simon Wesley said, distress rising, I think social media, bullying, exam pressures that might all contribute. However, what I didn't see reflected at the time was conversations around this wider environment and this threat that young children and young people are inheriting of our changing climate and a world that seems to be getting worse. And what is the uncertainty of that doing to young people's mental health? So we started to ask this question, and I went out with Pip and other colleagues to talk to people in the public about this. And as we looked into this in the research that was happening and in talking to the public, talking to children and young people, we saw their experiences reflected the experiences I had of feeling this grief, this anguish, this anxiety about climate change and the existential threats that we faced. And so this led to the Climate Cares program. So today I'm going to expand upon that and outline everything we've learned so far around how climate change interconnects with mental health, and outline the problem and the need we need to address urgently to safeguard children and young people's mental health. But this is about transformation. And so we're not going to only look at the problem, but what are the solutions? Where do we go to transform society? Future where young people can flourish. And how to get there? I'm going to give you recommendations that you can hopefully go with and take in this. I'm just turning off my camera. Hopefully that improves things. Go to the next slide. So part one, the problem and the need. And before we go into this, we'd like to hear from you. So if we go to the next slide, if you can all take out your phone or your laptop, anything you're accessing this talk with, and go to menti.com and enter the code 18386840. The link will be placed in the chat for you. And we're going to do an activity just to hear from you. We went to ask the public how they're thinking and feeling about this topic. I want to hear how you're feeling about this topic. So how does living in and through the climate crisis make you feel, or perhaps what you've heard from children and young people you're working with? Okay, so we're hearing that people are feeling alarmed, anxious, overwhelmed, angry, optimistic, scared, distressed, mad, uncertain, unsafe, hopeless, bewildered, powerless. And these are many of the things that we hear from children and young people. Okay, so we will send around this at the end of the presentation. So please continue to answer, but we're also going to go to another question. So before I outline these interconnections, I'm just curious of how much people have heard about the links between climate and mental health, and about the synergies for action that will support a same for climate and mental health. Okay, so at the moment we're seeing that most people are either completely new to the topic or have some small level of awareness. Great, and thanks everyone for jumping on and answering. Okay, great. So we've got someone in the room who has a lot of awareness. Excellent. So it's wonderful to see you all here, and hopefully everyone will take something new away. So if we go back to the slides, and thank you very much, Pip. From the feelings that you just described, it sounds like many of you have awareness of the situation we're in already. But just to outline the world that children and young people are growing up in. We are facing climate and biodiversity crisis. At 1.1 degrees of warming, which is where we're at now, we're already seeing a cascade of effects around the world. Over the next 20 years, global temperatures are expected to reach or exceed 1.5 degrees of warming. As global heating accelerates, we're expecting the threats to health and well-being to worsen. And so action is critical. And as the IPCC has said in its series of reports this year, we're currently behind, but change is possible. So if anyone's unaware, there's 3 reports that are released that I'll be referring to later. One is by Working Group 1 on the science summit. The second is on adaptations that we need to make, groups that are vulnerable and the current impacts around the world. And the third is on how we need to mitigate and prevent escalating global heating through cutting carbon emissions and stopping the burning of fossil fuels. We also have an affected biodiversity crisis. At the moment, only 4% of Earth's mammals by weight are wild, while 36% are humans and 60% are livestock. Next slide. People are waking up to this issue, and in November last year, climate change was the biggest issue for the UK public. This was reflected across 40 countries in 2020, where 70% of people were very or extremely worried about climate change. Children and young people are also very worried. Even before the pandemic, 73% of children surveyed by the BBC said they're very worried about the state of the planet, while 60% of teenagers and emerging adults last year around the world were very or extremely worried. Simultaneously, we have a mental health crisis. As you all know in this room, I'm sure, children and young people's mental health challenges are rising. This is accelerated by the pandemic. Now around 1 in 6 children in the UK have a probable mental health problem. And this is the worst in Europe, including even before the pandemic. The UK had the highest prevalence of severe mental disorders and substance use disorders. And what this means is that both because of this need and because of the good news of increased help seeking and reduced stigma, there's a massive treatment gap. And I'm sure all of you working in this space are well aware of these kind of statistics. If we go to the next slide, where mental health systems globally are strained. Mental health workers represent only 1% of the workforce. And this means in low resource settings, 90% of people do not get treatment. But even in high resource settings, only about 1 in 2 people receive treatment. But these systems are also vulnerable to climate change. So there's going to be damage to the services and supply chains, which may make this this gap even worse, while those services themselves contribute to emissions. So for example, the pharmaceutical industry making drugs is significantly more emission intensive than the automotive industry making cars. If we go to the next slide, because of this, global mental health has talked about how we need to reconceptualize mental health and well-being and the purpose of mental health systems and how they operate. And in this talk, I'm going to be using this idea of mental health and well-being. It rests on 4 pillars, that mental health is a global public good and is relevant to sustainable development around the world. Mental health problems exist along a continuum, so it's not enough to say that people are healthy or that they're well. This is important clinically, but we all exist on a continuum. And that mental health is influenced by social and environmental factors that then interact with genetics and physiology, including overdevelopment. And mental health is a fundamental human right. So we need to protect vulnerable individuals, but fundamentally enable an environment that promotes mental health for all, which is obviously what these seminars are about. And this is about creating a state where people can flourish. So it's not just enough to prevent illness, but to create a society where individuals can realize their own abilities and cope with the normal stresses of life. But I would argue that living through a climate crisis is also not a normal stress. If we go to the next slide, what global mental health is therefore saying is that we need an environment that fosters mental health and well-being for all. But the climate crisis gravely threatens this vision, as I'll now outline. At the moment, we have a situation where climate change is accelerating mental health needs, both directly and indirectly. And this in turn, if we don't act, is going to limit the capacity of individuals, communities, and systems to both cope with and act on this changing world. So this comes from our briefing paper that will pop in the chat, but we know that climate is accelerating temperature rise around the world. There is more acute and chronic extreme weather and climate events like fires and floods and droughts. And what this means is that there's a variety of impacts that global communities are experiencing, expected to experience. We've looked at these as a continuum because there are really a variety of pathways. On the left-hand side, we can see that homes and properties can be directly impacted. So children might lose where they're living. They might directly experience high temperatures, but their families might also lose their livelihoods. They might be forced to move from their homes. Their communities might break down. Their access to care might be disrupted. And so this all has flow-on effects. And then on the right-hand side of the continuum is when children and young people witness or are aware of these effects, maybe from hearing about it on the news. Next slide. I'm going to be talking about a range of mental health impacts. Again, thinking of them on a continuum. So the kind of outcomes we're seeing are things like increased cases of suicidal thoughts and deaths by suicide, increased symptoms and new cases of mental illness, increased susceptibility to physical ill health or even death for those with diagnosable mental illnesses, and also worsened population mental health and distress. Next slide. So if we look on the left-hand side of this continuum, we're all experiencing higher than average temperatures at the moment. And while the research is still ongoing, what we see globally is that above a local threshold, so as temperatures rise above what is sort of normal in that region, we can see that the rate and the risk of suicide can rise. So by about 1% for every 1 degree that the day is hotter. And so this has been estimated that in by 2050, sorry, go back to the last slide, that there'll be an extra 22,000 suicides in the USA and Mexico alone if we don't address climate change just due to the rising temperatures. We also see more hospital admissions in heat waves for psychiatric disorders, and community mental health is also worsened. So we might be having our sleep affected at the moment. We see more conflict in society, and also the medications people take for psychiatric disorders can interact with temperature and impair the body's ability to thermoregulate. Next slide. If a child or young person also directly experiences an extreme weather event, this is understandably very stressful and traumatic. And so when these are being reported around the world, we often hear about the number of homes destroyed, the number of lives lost. What we don't always hear is that for a minority of people, there'll be long-lasting psychological impacts, which can include higher suicide risk, substance abuse, anxiety, depression, and post-traumatic stress disorder. And that the number of people affected psychologically by being exposed to these disasters can even exceed those physically injured by about 40 to 1. So this is a big hidden cost. Next slide. But as I said before, there's a lot of flow-on pathways of impact, and climate change is destabilizing the things that we know are important for good mental health and well-being. The social, economic, environmental determinants are under threat. This can come, for example, from air pollution being worsened by climate change, and we know that has a range of mental health consequences, as well as physical health consequences. Food and water is getting more insecure. People are being forced to move from their homes, and their livelihoods and cultural practices are being threatened. And some of these constitute adverse childhood events and experiences. Next slide. But even on the right-hand side of that continuum, just being aware of these issues on children and young people's mental health is leading to a range of responses. So Caroline Hickman has looked at this in children and young people and seeing quotes like, all they have to do is look at what's going on. I don't get it. Why can't they see it? They say I'm the one with the problem because I'm scared, but I'm even more scared because they are not scared. They should be. I'm living in the twilight zone. Help me. I don't want to have children because I don't know what kind of world are we bringing them into. And in our recent research in the US, about 1 in 5 people felt this way, age 16 to 24. Next slide. So these kind of anecdotes have been rising, but what we are starting to see is that this is reflected at a broader scale in the data. So last year, there was a survey of 10 countries of 10,000 young adults. People were worried. 60% of people globally were very or extremely worried. And the majority felt sad, anxious, angry, powerless, helpless, and guilty, reflecting a lot of what you said earlier. And this has daily life impacts for about 45% of them. And this includes things like sleep and relationship impacts. But this is felt unequally. So if you look at the graph on the right, the UK at the moment, about 28% of young people are reporting these daily life impacts, while in the Philippines, this rises to 74%. So as these impacts accelerate, we're expecting to see this rise for the impacts on children and young people. And vitally, this is not just about climate change, but this is about being betrayed by the people supposed to protect them. 65% felt the governments are failing them, and nearly 60% felt governments were betraying them. Next slide. We're also seeing this in the UK. So we did a survey in 2020, and even in the midst of the pandemic, children and young people were saying that climate was more distressing than COVID, which was quite surprising when they were saying that COVID was understandably causing much more disruption to their daily routines. And this is particularly true for people who weren't otherwise anxious. And there was differential emotional responses. So they were more interested and engaged by climate change, but also felt more guilt and shame and more anger and disgust, while COVID was more associated with isolation, disconnection, and frustration. And if we look at this, so okay, we can go to the next slide. These kind of experiences are starting to be researched and new terminologies evolving. So you might have heard things like climate anxiety and eco-anxiety. The American Psychological Association has called this a chronic fear of environmental doom. And research tends to conceptualize it as related to fear and worry, but also to existential anxiety. You might have also heard terms like solastalgia and ecological grief. And this is about losing the solace that you might feel from connection to the natural environment and seeing the landscapes around you change in profoundly negative ways, and grieving for the losses that we're seeing. But importantly, again, it's not just anxiety, it's not just grief, but there's a range of psychological and emotional responses. And this can move from people feeling denial and disavow to overwhelm, anger, despair, guilt, and fear. And researchers like Panu Pakala have looked at a taxonomy of eco-emotions. And importantly, the research is showing that the social and cultural dynamics and the narratives that we hold shape these experiences. Next slide. So how many children and young people are being affected in this way? And how does this link to mental health? So things like climate anxiety and eco-anxiety, how does that relate to conditions like anxiety and depression that are what we usually look at in mental health? So at the moment, the evidence is somewhat mixed. We are seeing that, for example, across 25 countries, negative climate emotions have been linked with insomnia and worse self-rated mental health. And some studies have found that worry or anxiety about the climate is linked to lower well-being, but importantly, it can also be linked to things like a high degree of meaning in life. And what research is saying is it's really important to actually look in a more nuanced way at these different emotional responses and to separate things like worry from emotions such as hopelessness, which more strongly predicts worse mental health. Across the board, we're seeing that many young people are feeling sort of moderate levels of concern and distress. And then a smaller but significant group are feeling very high levels of distress. And anecdotally, some of these young people are even suicidal, even if they had no previous mental health conditions. Some of this different pattern in the research that we're seeing comes down to the way that these things are being measured. So there's a range of scales emerging to measure these kind of experiences, but they all incorporate different kinds of behavioral and functional responses, cognitive responses, affective or daily life impacts. And so again, it's really important we start to unpack and look at this in a more nuanced way. But what we are finding, if you go to the next slide, is that it is vital to see this kind of distress as non-pathological. It's related to empathy, to caring about what's happening, and it's natural and understandable to be really scared in light of the threats and the facts. And it can even be an adaptive response that motivates us to act. But at the same time, it's a chronic and ongoing stressor. And feeling betrayed by the people who are supposed to protect you and feeling this ongoing stress without being told how to cope can create or exacerbate mental health challenges. But with the right support, we can have high well-being and hold that climate distress. And we're seeing that young people who are worried but still experience well-being have higher hope, meaningfulness, and also things like anger that are also driving them to act in ways we'll look at later. So to sum up section 1, from all of those pathways I've told you, the climate emergency is a mental health emergency. Without action, this need that we're seeing, this treatment gap that we're seeing is only going to accelerate. But what this means is that climate action is mental health action. If we go to the next slide. Oh, sorry. The climate and mental health emergency is also widening existing inequalities. So what we're seeing globally is that mental health is worsened by power imbalances, experiences of disconnection from others and from our lands, and the long-term consequences of colonialism on communities and extractivism, where we're taking in the global north from the global south. But this is linked to experiences of climate change. So for example, Aboriginal people in their communities are saying the impacts of climate change resemble the experiences of colonization. This is reflected in who is most vulnerable. Climate change exacerbates inequalities that already exist. And of course, those who've experiencing the worst effects have contributed the least, including children and young people and future generations. Just as an example, in 2000, 88% of the increased burden of global disease, which is physical disease primarily, attributable to climate change, fell on children. But this is also because physical and mental health is strongly linked, affecting children and representative of how children and young people are being affected directly. Again, people with pre-existing vulnerabilities to mental ill health are more vulnerable, and even people with pre-existing conditions are 2 to 3 times more likely to die in a heat wave. Next slide. So if we zoom out, we're at a place where there are all these interlinked crises. People who live in places with poor air quality, for example, which fundamentally comes from burning fossil fuels, are more likely to die from COVID-19. They're more likely to experience depression, anxiety, and have higher suicide risk. They're more likely to experience physical health problems, and they're more likely to be from a poorer community. So I want you to all hold this perspective in your work, that whatever part of this system you're working in, all of these things that we're experiencing in society are fundamentally linked and feeding each other. Next slide. And this is because that there are common causes in the way our societies are currently structured and the cultures in which we live that are fueling these multiple crises. And this includes things like the disconnection between people and us and us with ourselves and us and nature. Having fossil fuels that are fueling air pollution and killing people globally and worsening their mental health and well-being, as well as making poorer food and water security. And we have widening inequalities, as well as a range of other common causes. If we go to the next slide. I won't have time to go through this in detail, but you'll get the slides later to see the evidence that the IPCC and others have outlined in how these common causes are linked from a mental health perspective and a climate perspective. So all of these things worsen mental health, they also worsen climate change. For example, income inequality is associated with poor mental health, but also countries with higher income inequalities have higher global emissions. Next slide. And what this means is that there is a vicious cycle where these crises are reinforcing each other. So we need to mitigate climate change to break this vicious cycle. Next slide. So climate action becomes a mental health action. Next slide. So now we're going to look at where we want to go. How do we fundamentally transform at all levels of society to not only break this vicious cycle and mitigate all those pathways by which climate change impacts mental health, but also I'm going to demonstrate we can go beyond that. And because there are common causes, there are common solutions. And this is co-beneficial, but also codependent. And so climate change is not only a grave threat, but a huge opportunity to redefine the social and environmental determinants of health, including mental health. Next slide. But we need a certain type of climate action at all levels to transform our society. And this vision centers the well-being of people and planet and supports a society that will create a virtuous cycle for children and young people. Next slide. I'm going to demonstrate there's a symbiotic relationship between climate action and mental health action. There's a wide range of co-benefits across all levels, and they're also codependent on each other. And so an analogy is a forest that has a mitochondrial, sorry, not a mitochondrial, oh my goodness, I'm having a mental blank. The fungal network that is connecting all of these trees in a wood wide web that has nutrients to all of the different trees. And so if we help all of those different levels, the mycelium network can fuel the trees. If we go to the next slide. And hope lies in the interconnected nature of this work. Systems are fundamentally created by communities and individuals. Communities are made up of individuals, and individuals are a part of and can influence communities and systems. And so whatever part of this network you're working on, you'll have ripple effects across this network. Next slide. So if we go again to Mentimeter, we can look at this vision of transformation. So I'd like you to reflect before I go into our vision of transformation of where you imagine there could be connected transformation. Everyone's thinking. If you have no ideas, then education, then it'll be more to learn, I guess. But I'd love to hear what people's imagining. Daily habits, local politics. Thank you everyone who's jumping on and answering. In fixes and new methods of living, in action. Within the community, a new version of community and employment. Agriculture, schools and governance. In natural community, a connectedness to nature, connectedness to community, connectedness to self, sharing information. I feel like you're writing my talk for me. This is fantastic. Supporting parents to support their children and young people, to make sense and act on changes. General hopefulness. Fantastic. So despite saying at the start that there was limited awareness of the connections between these issues, there's already loads of ideas here. And again, we'll share this in the chat, in the slide deck later. So if we go back to the slides, I'll now outline what our vision is across these different levels. So again, these levels are connected, but if we look at the individual level, what the IPCC has said is that we need lifestyle and behavior changes. And this could cut 40 to 70% of greenhouse gas emissions by 2050. What we know is vital for securing a safe future for children and young people. But these lifestyle changes themselves can improve health and well-being. Next slide. So how do we help individuals cope with this rapidly changing world? We've seen that children and young people are sitting with all of these different emotions and psychological responses. And this can be deeply uncomfortable and challenging. And climate action has to follow from an individual transformation. We need to move from awareness to having a space to reflect and to process before we can move into action and before we can sustain action. And this relies on emotional and social skills that mental health and well-being professionals know about. And in response to this rational threat, we need a psychological and therapeutic understanding to help children and young people. If we go to the next slide. If people are overwhelmed with anxiety or with grief, the evidence says this can be part of leading to inaction. But if people in our communities, particularly leaders, are sometimes underwhelmed with denial and disavowal, we need the expertise of mental health professionals to understand, to hold compassion for this, and help with this intergenerational crisis of moving leaders to act. And both responses are just defense mechanisms trying to keep us safe in an unsafe climate. Next slide. But there is a lot of evidence that there's a range of emotions that can also inspire action. Hope and agency, but even anger and rage and injustice can inspire action. And that action itself can improve mental health and well-being. And when we look at the evidence for this, we're seeing this emerge. So if we go to the next slide. Hopelessness and powerlessness seem to worsen mental health outcomes for children and young people, as I said. But hopefulness and agency can safeguard mental health and help people sit with climate distress, but in a way that protects them. And hope itself can be linked to a sense of agency. So if we can develop in students an opportunity for them to see the effectiveness of their own actions and take pro-environmental behaviors, this can be linked to higher well-being and meaning in life. But importantly, this is not about seeing the future as completely rosy, but not holding hopelessness. Next slide. So if we take a closer look at hope, many of the researchers looking at important coping strategies for children and young people have emphasized hope, but a particular type of hope called active hope, where people do things in line with their values and are active participants in bringing about the future they hope to see. And this is different from passive hope, where we just wait for external agencies to bring about the world we desire. If we go to the next slide. And again, the emotions and psychological responses children and young people have, and actually all of us have, really interact with the narratives we hold and are told about climate and about the world, and that we're hearing from the media and others. And one thing we've found really helpful for children and young people, but really for all of us, is to make sure, as mental health practitioners know, we can sit with duality and sit with sometimes uncomfortable emotions and validate them at the same time as holding space for hope. So things are bad, they're getting worse. But no matter at what point we're at, there's always a better and a worse path forward. So we can feel anxious about the future and push for that future that we desire as individuals and together. And there's power in committing to this change in perspective. There's many amazing organizations helping with this individual transformation and supporting people to have the skills to cope and act. This includes people who are climate aware psychotherapists, like the Climate Psychiatry Alliance and the Climate Psychology Alliance. Also organizations like the Inner Development Goals that have outlined these skills that mental health practitioners will know and created a framework to help people move through this experience. We're also working in this space with our co-designed self-guided journal and Hold This Space, which is a digital platform also done with Common Vision and Force of Nature and science, climate scientists. Next slide. But it's not enough for us to act as individuals, and particularly children and young people don't want the burden all on their shoulders. We need to push for community action. But community transformation is also what the IPCC has called for. If we're going to live through the climate crisis, we need communities to be resilient, but more so than just the ability to bounce back, they need to have the capacity for transformation. So what does that look like? Next slide. From a climate perspective, this fundamentally relies on mental health and social well-being. To build this capacity for transformation and resilience in communities, that the world that children and young people will inherit and need to live through, to cope with and act on climate, we need communities that have a strong social fabric, pro-social values, and social infrastructures where we can disseminate these kind of mental health supports, opportunities for action, and coping and acting skills that we just discussed. And collective action itself, these opportunities to come together in communities, is where we see the source of mental health and social support that helps children and young people cope with climate distress. So what children and young people themselves are saying is that climate activism, particularly collective, can promote resilience, especially when they can emotionally engage and when mental health is systematically supported. Next slide. So this social infrastructure looks like using the places where children and young people are already at, in their schools, universities, community centres, places of worship, and also having space for them to be heard within business. Next slide. And IPCC again says we can't adapt and live through the changing climate without participatory approaches, without including the voices of people on the ground with lived experience and local knowledge. And this includes listening and acting on the desires of young people. Young people are feeling betrayed by their leaders, and they say that having opportunities to be meaningfully heard and listened to, and this to be acted on, can help with the distress that they feel. And again, we're seeing this in the research, where participatory approaches, as well as, importantly, those that are place-based and culturally relevant, are helping young people cope with their eco-emotions. Next slide. But even if we weren't in a climate crisis, mental health and well-being already requires community transformation. And global mental health has been calling for this, particularly for youth mental health, because of this treatment gap. If we're going to prevent mental ill health and improve well-being, we already need to be strengthening connections and a sense of belonging in communities. We already need to be meeting children and young people where they're at and equipping them with these skills. We need timely, accessible, and suitable mental health support. Next slide. We're also seeing from global mental health that we need an understanding of mental health that takes into account young people's culture and context and sees them as part of their community and part of their culture. And this is again intersecting with climate. So the Aboriginal Health Council of Western Australia are saying when we talk about the mental health impacts of climate change, we're talking about the loss and disconnection of our spiritual identity, our cultural beliefs, and our values. And these are essential requirements for our own life force. So the mental health and well-being of individuals is fundamentally linked to their community and the health of their lands and planet. And this kind of holistic understanding is what we need to bring into an understanding of the place of mental health and social well-being within our communities and within our cultures. Next slide. We need a transformational shift within communities towards cultures that fundamentally center and care for people and the planet. And working with communities can simultaneously strengthen their capacity to support good mental health and well-being, enabling them to better prevent and treat youth mental health and mental illness, while equipping them simultaneously with what the IPCC is saying is fundamentally required if we're going to live through the climate crisis, and having that resilience and transformational capacity. While that action itself, working collectively for climate action, further boosts mental health and well-being. So there are, again, many examples of success that I'll let you peruse later in your own time. But some of them are things like green social prescribing connected to climate, embedding wellbeing support in schools. So the Anna Freud Centre is already working on whole school approaches. We're hoping to work with the Anna Freud Centre on this. They've already got family hubs, and we can link this to the skills that we need for children and young people and their families to cope with and act on climate. Organisations like Force of Nature are run by and for young people to mobilise mindsets for climate action, and also to have young people's voices heard within business. Next slide. So communities are made up of people, and if we are going to live with and through the climate crisis as children and young people, we need to vastly accelerate the transformational shifts we have in our systems. At the moment, no country meets the needs of its citizens at a resource use that's globally sustainable. So earlier we looked at the common causes for how the way our systems and cultures are set up right now are worsening mental health outcomes and also worsening outcomes for the climate. These common causes mean that there's common systematic solutions. If we move, for example, from disconnection in societies between ourselves and others and us and nature to more connection, we have better outcomes for mental health and also for the planet. But also within our systems, like stopping burning fossil fuels would improve air quality and improve the physical and mental health of millions of people worldwide, while also improving food and water security, which also has big physical and mental health benefits. So what does this look like to have this kind of systems change? I'm going to give one example now. So we wouldn't usually think of improving the energy efficiency of housing as a mental health intervention. At the moment, we're living through a cost of living crisis exacerbated by the crisis of the war in Ukraine. But also because we haven't had enough investment in renewable energy in the past. What this means is come winter, there'll be more families struggling with the decision of whether to heat their homes or eat. This means stressed parents. This means children who might not have the food and the warm home that they need for their physical and mental health. They might miss days of school because of more sickness we see in the data. But because these things are fundamentally connected, what we can do is reverse this by properly insulating the house. This reduces the emissions from the fuel use. It also means the parents are less stressed and money is less tight. Children are less likely to miss school, and their physical and mental health vastly benefits in numerous ways. So these kind of system changes, including things like increased provision of green and blue spaces, or more walking and cycling facilities with less air pollution from car traffic, reduce inequalities we see in the children and young people exposed to these challenges, which are primarily poorer and people of colour, but also that has numerous benefits for their mental and physical health. And the IPCC and others are very helpfully outlined, if we go to the next slide, the range of policies that have these dual benefits. And again, you'll have these slides to look through this later at your leisure. But what we see is for any of these system level policies, it's not only reductions in emissions, but mental health and well-being that vastly stand to benefit. So beyond needing climate action urgently to safeguard a livable future for children and young people, this climate action itself can transform society in ways that will vastly benefit the mental health and well-being of these children and young people. But more than that, these also depend on each other. So in summary, we need to account for the impacts of climate on children and young people's mental health in ways that there is sometimes limited awareness, and these costs are hidden, but these benefits are also hidden. And we need to take this into account and advocate for this in mitigating and adapting. Climate action is mental health action at all levels of society. These are co-beneficial. There's win-wins that are possible. They're also codependent. They rely on each other. We need to use the climate emergency as not only recognizing it's a mental health emergency, but it's an opportunity to transform society in ways that global mental health is already saying we need for children and young people's mental health. So even if we didn't have a climate emergency, these things are good mental health and well-being policy. But in the face of a rapidly changing climate, this becomes ever more urgent. Next slide. So how do we get there? I realize we're short on time, but I'm now going to try and outline what you can do. And again, you're going to have these slides to look back on later. To come back to that idea of a connected ecosystem, if you think of yourself as an individual practitioner, and this comes from a paper that's coming out in a special issue of the International Review of Psychiatry, that's looking at the lived experience of mental health practitioners trying to cope with and act on climate themselves in their lives and their practice, you'll see that people are thinking of themselves as an individual within a wider ecosystem. And the more we have individuals popping up in ways that are independent but also connected, we come back to this idea of a network where action in any one place can support the health of the network as a whole and across individuals, communities, and systems. And that's a powerful thing. What I have outlined today in terms of the research, in terms of policy, and in terms of practice, there's still a lot to learn. But again, we can borrow a lot from what we know in global mental health already, and your knowledge and expertise is vital in this space. What I have outlined is that we need a reimagined mental health system that goes beyond the clinic and into communities and into equipping young people, their families, as individuals, as communities, and advocating at a policy level for achieving a vision that centers the flourishing of people as the central role of societies, governments, and healthcare systems, that relies on a culture of care, as Sally Weintraub and others would argue, for people and planet. And again, this aligns with what global mental health is already saying. The Lancet Commission on Global Mental Health and Sustainable Development said, we need to work together in a network to engage a wide range of stakeholders within and beyond health, as the Anna Freud Center does, in education, workplaces, child and youth services. And this has to target the social and environmental determinants that influence children and young people's mental health. Again, global mental health has approaches that we can borrow to scale up how we respond to the climate crisis. And this includes train the trainer models, digital mental health initiatives, and things that upskill community leaders. So there's many examples of this, but SOLAR is one of them, Skills for Life, Adjustment and Resilience, that's shown really great promise in protecting mental health and well-being in communities in Tuvalu, and also communities is now being used in Australia and California after the bushfires. And so part of our strategy is to work with communities in these networks like we discussed. Next slide. If you're part of a mental health system, you can also be part of switching from being the problem to being the solution. You can be part of advocating and working towards sustainability and net zero mental health systems. And again, we can share resources that talk about how to be the change and lead the change. And one example is the Centre for Sustainable Healthcare that looks at quality improvement frameworks that enable you to measure and with a vast range of ideas of how to move towards net zero and think about what it really means to be sustainable and center that flourishing of people and planet. Next slide. And again, there are many examples of hope everywhere. One I'll just highlight now is SHINE. So I talked about energy efficiency of housing. SHINE actually works with GP surgeries, and those GP surgeries refer vulnerable people who are experiencing the mental and physical effects of cold homes and fuel poverty. And SHINE can then give advice on fuel debt and energy efficiency and help residents access discounts on things like new boilers. And this has saved an immense amount of carbon emissions and also improved the fuel poverty of beneficiaries. And this is helping the children and young people in the families that are experiencing these challenges. If any of you are mental health professionals, I hope you've also seen and maybe already realizing that there's lots of things you can do in your practice and in your community. Children and young people and their families want support and validation of their experiences of climate distress. They want you to be climate aware, to continue to learn and talk about these issues with your colleagues, but understand that this is not a mental illness to be worried in the face of climate catastrophe, but it can impact mental health. And so we need children and young people and their families to have those tools that you can provide. But you can also do this beyond the clinic, in communities and existing infrastructures. You can be part of advocating for the policies that I've described that dual consider mental health and well-being, impacts and benefits. And again, you can advocate within the workplaces and systems for transformation and centering this sustainable practice. And again, there's lots of great links that we can share. This includes things like 9 things you can do for your health and the planet that my colleagues at the Grantham Institute for Climate and the Environment have developed. And again, there are many communities that are really looking for support. You could work with climate cafes, you can support young activists, you can work with schools, and you can make sure that green social prescribing initiatives are linked to climate action. You can advocate for change. For example, Psych Declares was a group of psychiatrists that got the Royal College of Psychiatrists to divest from fossil fuels. We're also working with the UK Council for Psychotherapy, who has convened mental health professional bodies across the country to create a climate emergency mental health professionals group to advocate as one. We're also working with Gary Belkin, our colleague in the US, and Kokoro, on something called a mental health COP. And this will have voices working in this space around the world to prioritize asks to feed into the COP27 in Egypt this year and make sure mental health and well-being is front and center. At the moment, a survey of 95 countries have found only 9, so less than 10%, have included mental health and psychosocial support in their national health and climate change plans. So we really have a long way to go. If you're someone working in policy, you need to make sure to mitigate this climate distress, you listen to the voices of children and young people and provide meaningful opportunities for their involvement in decision-making. You stop the betrayal by showing proportionate and visible climate action and make sure those policies also benefit mental health. And you have trustworthy governance that ensures the co-benefits of climate action are incorporated into the way you respond to the crisis. And again, use those who are particularly vulnerable and their lived experience to guide your action. In education, and anyone working with children and young people in schools or in universities, or even as a parent, we need to consider that there's a balance between presenting climate facts and also allowing space to reflect and take into account the importance of hope. And this quote says there's a fine balance between safeguarding the mental health of students who might feel climate despair and inspiring them to take personal action. And that education, that need means that we need to educate people working with children and young people. We need to educate mental health professionals, teachers, parents, and make sure that those mental health skills we discussed earlier, those coping and acting skills, and that understanding of climate psychology is embedded in climate-related education. Because otherwise what we're hearing is people turning away from careers in climate because they're so distressed by what they're learning at a time we need every career to be a climate career. So finally, next slide. Anyone working in mental health research, I urge you to develop or join the global networks across sectors that are emerging. And this goes for anyone working in this space. There's emerging research to help quantify the hidden costs and the benefits of climate action to mental health and well-being. But there's still a lot of work to be done on deciding the definitions and conceptualizations of these issues. And again, unpacking the nuance across cultures and making sure we use appropriate metrics and data. We need to map and scale up evidence-based interventions, and Climate Cares is involved in this. And again, as always, center the lived experiences and the voices of those particularly vulnerable. Climate Cares is working in this space across research, education, policy and practice, and intervention design. So what we're doing is looking at evidence, trying to raise awareness of that evidence, and also co-designing solutions. Next slide. I'd like to thank everyone so much for listening. I'd like to particularly point out that my colleagues Jessica Newberry-LeVay and Pip Beatty have made a huge contribution to the talk and the slides, but also my colleagues across the Climate Cares team and our global advisors and supporters, and everyone working in this space from different sectors have been a huge part of contributing to the narratives and the examples we've shown here today. In closing, I'd like to outline that the transformation of society we need for the mental health and well-being of children and young people is strongly synergistic with what we need for a safer climate future. I hope I've shown you that climate action is mental health action. They're co-dependent and co-beneficial. These things are what we need anyway, but the climate crisis makes them ever more vital. But I wanted to leave the last word with children and young people themselves. This is again from a paper that will be coming out in the International Review of Psychiatry in September, that's co-written by 23 young people around the world. And what they've said is that while the climate crisis often leaves us feeling despair, we also believe that a radically more compassionate world is indeed possible, a world that protects the well-being of people and nature around the world. We, the 23 young people, know that it will not be easy to make these transformations, but we want to be part of efforts to make it. We want to hold on to the hope that if we work together, a more beautiful future is actually possible. So I hope you take that away with you today.
Thank you very, very much, Madam. That was absolutely a fantastic presentation. You could perhaps experiment with putting your camera on so people can see you again. Maybe the sound will survive. Well done. Brilliant, and you've covered an incredible amount of material across a whole range of areas. But there's one thing that came across it, really, that bringing together climate change and mental health means really rethinking mental health quite fundamentally in many ways, particularly the interdependence that we have in maintaining each other's mental health, as well as finding solutions to mental health problems that we might have with each other together rather than individually, with communities, but also within systems. And that perspective, I think, really genuinely brought home the value of bringing these two topics together. I've got some questions already, and we've got to be fast because we don't have a lot of time. So got probably more questions than we will be able to answer. But the first question, how can we better influence the government in the UK to act, to be more green and be less motivated by profits from oil, coal, and so on?
I think that's a great question. Unfortunately, I don't know if I have all the answers to that, but I think part of it that we see is making people aware of, and making the government aware that this is also a mental health crisis and a physical health crisis. So if we can make what are currently sometimes hidden costs of inaction very visible, and the huge toll this is taking on communities, then hopefully that can be part of the solution. And also mobilizing communities and being part of this collective action and mobilizing practitioners to come out and advocate for that change. The more voices that are advocating for change, the better. And also I think mental health can understand maybe some of the psychology of why this is, but it's also making people aware of how these challenges are linked and are affecting them, you know, things like the cost of living crisis, how that is actually connected to inaction on climate as well. So if we can, as practitioners and trusted voice, well, I'm not a practitioner, but as mental health professionals, you have a very trusted voice in society. And if you can raise awareness and advocate for those changes and make aware the huge hidden costs on individuals and communities, I think that's part of it. But also the benefits, I guess, of action, that if we do this, there is a huge win-win. So it's, even if you didn't care about climate change, actually making these kind of changes are beneficial anyway.
Yes, I was going to raise an eyebrow when you said that as mental health professors, we are trusted, particularly by government. I'm not entirely sure that that's true. But I have another question.
I think trusted in the community, though.
You are, well, on a good day. Anyway, but I got a question which is, I think, really quite challenging. Should our definition of mental health and mental well-being more actively involve connectedness to community as opposed to just contributing to community? And that refers to a WHO definition.
Yeah, absolutely. So,
what you mean.
Yeah, absolutely. Yes, a resounding yes to that question. So if I didn't make that clear, I definitely would like to make it clear now. We're talking about increasing connectedness. We know that connectedness, belonging, strong social connectedness to nature is all very beneficial for mental health and well-being, can help with prevention and treatment of youth mental health challenges, and contribute to this sort of positive flourishing that we want to see in communities. And so it is really about that connectedness. And we see that because of connectedness in our societies, any sort of challenges within one area of the network can spread. But what that also means is that solutions can spread.
Okay, I've got a question for you to say, again, slightly on the challenging side. The questioner asks, isn't it problematic to use the medical model terminology of mental health, which because implies mental illness, as we know, of those who struggle, pushing the problem into individual and actually talk about addressing and treating the health of communities and society and health of the planet. I mean, the question is not really fair because you are very clear that you do mean communities and societies. But isn't there a risk just by focusing on mental ill health or mental well-being even at individual level as a kind of indicator of the problem, that you are taking away from the attention that should be given to society at large?
Yeah, so this is something that gets discussed a lot in this space and there's no perfect solution at the moment. I think terminology like mental health and well-being is often easily understood, and actually we're hearing in these kind of discussions, people from the global south saying, well, actually, this is terminology that we find really useful at the moment. And even words like eco-anxiety, we find really useful. Others find them sort of problematic. I think I tried to outline that when I talk about mental health and well-being, I'm not just talking about mental illness. When I talk about climate anxiety and distress, I'm not talking about pathologies. And that the mental health and well-being has to be reconceptualized in a way that ensures that we understand that the health of an individual is part of their social and environmental health, and that we all exist within our culture and our communities and the systems in which we live. And as people have sort of said, it's not potentially healthy to be well adapted to sort of a society that has these challenges. So being upset by them shows an empathy and a care. But yeah, I guess this is an ongoing question really to the community of how we frame this and how we think about mental health and well-being and the terminology that's used. But I think that global mental health is already saying we need to look at this wider context for mental health. We need to look at the social and environmental determinants. And, you know, many cultures around the world are saying that our health and well-being exists within and is seen as this holistic picture. And I think that hyper-individualism that I have on one of the slides as a sort of common cause to some of these challenges does refer to sort of an over-medical model that can sort of look at an individual sort of boxed and separate from their wider context. But at the same time, it is important to note that people who have what are now sort of known as diagnosable mental illnesses, they are also more vulnerable to the effects of climate change. They're more vulnerable to the effects of heat. They're more vulnerable to these compounding inequalities. And so I also don't want to miss that there is a vulnerable group who experience what are sort of commonly more referred to as severe mental illness and psychiatric disorders, that those individuals, you know, their illnesses, their health is also linked to this wider network. But it's important we recognize that they are being particularly impacted by climate change.
Unfortunately, we run out of time. There are lots more questions. I'm really, really impressed by your presentation and the thoughtfulness and the breadth that you bring to it. And I have to say, I feel convinced that that the entire theme of making mental health a business, not just of communities, but of social systems, is really the right way to go if we're going to combat the crisis of mental health as well as the crisis of a climate. And what gives me hope is the kind of thoughtfulness that in people like you, and you particularly represent, that you bring to it a kind of energy and the kind of creativity that make a person who's perhaps caused the problem less than providing the solution feel a great deal better, that we might get out of the mess that we've made for ourselves. I want to thank you, Emma, not just for this talk, which was brilliant, but more widely by your commitment to an important cause that may in fact turn out to be the cause of our century, which is bringing together the issues of our physical environment and our internal mental environment that we experience inside our brains. And I can't imagine a person better qualified to do it than a neuroscientist who is also qualified in physics and some of those that are out with my comfort zone. So Emma, thank you so much for your presentation. It is important, as important as anything can be, and you bring to it wisdom and clarity that I think we will benefit from. Thanks very much.
Thank you so much. It's such a privilege to be here, and just in the spirit of community and working together, it's I just want to emphasize it's not just me, but the Climate Cares team and all of the wonderful advisors and people we work with at Imperial and externally in the UK and globally, who are part of contributing to this thinking, this momentum, and the change that we hope to see. So I'm really thankful for the questions. I'm spending time, and I'm happy to answer them by email or something. I can put my email in the chat. And thank you so much for coming. And I'd love to continue to work with you all.
Thanks very much, Emma. And thank you everyone for coming. And if you feel able to, and you enjoyed the seminar, you can donate to the center by visiting the link we'll share in the chat now. And thank you for the support that you've given. I hope that together, in the way that Emma has suggested, we can improve the lives of the children and their future on this planet, not just in our country. Thank you very much, and good evening.
Thank you so much.